Welcome to Navigating Nursing, the podcast where we explore the many layers of the nursing profession. Wherever you're a caregiver, a student nurse, someone considering a career in nursing, or just curious about the field, you're in the right place. I'm Tristan, and in this very first episode, we'll focus on the journey of the student nurses and newly qualified nurses. Nursing is a career like no other. Every nurse has a unique story to tell, and today we'll be hearing from Millie, a dedicated nurse who will share her insights and experiences with us. Together, we'll explore the realities of nursing, its challenges, its rewards, and even take a glimpse into what the future of nursing might behold. Let's start by discussing nursing in today's world. Nursing has evolved significantly over the years, becoming more dynamic and diverse. Nurses play a vital role in patient care, education, and even policy making. For example, did you know that the World Health Organization declared 2020 as the year of the nurse and midwife? This acknowledgement highlights just how essential nurses are to healthcare systems. However, the profession is not without its challenges. Staff shortages, increasing demands, and staying up to date with advancements are just a few issues nurses face daily. So, I'm joined here with Millie, a 23-year-old new qualified nurse from East Sussex. How would you describe yourself as a nurse?
I think I am really enthusiastic and I love learning, which is a big part of nursing. So I see new things every day, I get to learn new things every day, and I think I'm a keen learner and I always like to get involved in things and always like to find out what's going on so I can learn from the situation. And I do feel like I can be very empathetic and caring, and I'm able to imagine how I would feel in the situation that my patients are in, and really that way help them by understanding how they feel and what they're going through.
So, when did you realise you wanted to be a nurse and why?
Oh, this is a good question as well. I don't think I realised straight away. I think I've always had an interest in it, as quite a lot of my family work in the NHS or do nursing. It must have been when I got to about maybe 16, 17. I was just... I was doing my GCSEs and I was like, oh, what do I actually want to do with my life? And I remember seeing some documentaries on nursing and stuff and thought, that looks so cool. I had a big interest in medicine. So I think I sort of went forward with that in mind. I wanted to do midwifery originally, but I kind of was more drawn towards children's nursing in the end.
Do you think nursing is anything you imagined it, and why?
Nursing is not everything I imagined it to be. I'm still so happy I picked it as my career, as hard as it is. I think a lot of students going into it are all the same, you have a certain idea about it. However, we are all going into the failing system, which is the NHS, and I feel like that threw a whole new perspective onto nursing for me, and it opened up new difficulties that I didn't even think would exist. It isn't what I expected it to be. I get to look after children, I get to make them better or care for them in whatever that way that they need. But no, I would say that my perspective on nursing has definitely changed over the years.
How do you keep up with the latest research and practices in nursing?
So in the NHS, we're very lucky. We have a lot of nurses who come around and help us. So we have people like practice educators who come around and teach nurses new skills, new guidelines that have come out, new things in medicine. So that's one way that we all keep up to date on our skills and our practices. And one part of nursing, it's important to do your own research. So if I don't understand a condition or a medicine, I look for peer-reviewed articles and help myself understand it a little bit more, or I can refer to a doctor in that field who's able to teach me the new skills. And also things like RCN articles and things like that, they always come up with new information. I'm up to date with them. That's a really good thing that I use.
How often do you think you keep up with the latest research and practices?
How often?
Is it once a week, a few times a month?
It depends. I'd say at least once a week, actually, because there's always new things happening in nursing and medicine, all the time, and I'm learning new things every day. I'm seeing new conditions I've never seen before, different children with different things. So every day I'm having to ask questions, I'm researching for articles about it, I'm looking online, I'm asking people. So honestly, more than once a week, definitely.
Now, we are moving on to specialised areas in nursing. A specialised area is a distinct field of nursing that focuses on specific patients, treatment methods, or work environments. One of the most exciting aspects of nursing is the opportunity to pick a certain area that you want to work in, from paediatrics to emergency care, mental health, and beyond. There's something for everyone. Specialised nurses often receive additional training and certifications to excel in their fields. For instance, did you know that nurse anaesthetists are among the highest paid nursing professionals, with extensive training that allows them to administer anaesthesia during surgeries? So, what is your specialised area, and can you talk me through what it is?
So I don't really have a specific specialised area, having been so newly qualified. However, I suppose, as I've just gone into it, you could say general medicine or general working, because that's what I'm in. So day-to-day things that, let's say, I do the most is things like respiratory illnesses in children. So I'm quite good at oxygen management. I'm quite good at weaning children on and off oxygen, the different types of delivery of oxygen. So things like, I know when they might require a nasal cannula, I might know when they require a mask or something like Optiflow, and they're all different mechanisms of delivery to oxygen to people and children. And I'm very good at, I'd say, now managing those, and that is, I think, what I'm probably quite good at in my job.
What specialised area would you not want to work in, and why?
Oh, that's a good... I love this question. I personally don't think I could go into oncology, so cancer, and that's because I'm such an emotional person that I feel like I would find it too difficult to deal with, and because of that, I wouldn't be able to treat those children as well as they can and should be treated due to my own emotional things. And the nurses who do it are honestly incredible. Some of the most skilled and best nurses I've ever met in my life. But just for me, I find it quite daunting because I feel like I wouldn't know how to administer their medicines properly or manage their medicines. And yeah, I'm just a very, very emotional girly, and I think I wouldn't be able to give them the best care that they deserve.
Next, we are moving on to the emotional and physical demands of nursing, as well as the enjoyable experiences that make it all worthwhile. Nursing can be rewarding as it is demanding. Studies show that nurses experience high levels of stress compared to many other professions due to the emotional and physical demands of their work. But it is also one of the most fulfilling careers. For example, research published in the Journal of Nursing Management found that strong peer support networks can significantly reduce stress and burnout among nurses. This shows how important teamwork is in the profession. Which parts of your nursing career have you found the most challenging?
Having been so new, I have to say I still think my degree, working in it, is and will always be the hardest thing I have ever done. Categorically. That was the toughest years of my life because you have to do 2,300 hours of unpaid placement and working on wards. I found that very emotionally draining, difficult. I saw so many things in so many different fields. But I'd also say going in as a newly qualified nurse, it is very overwhelming because now the responsibility is all on me, or it feels like that, and I'm so scared of making a mistake, so that's quite hard to deal with, and I do get really anxious. I really worry a lot. I'll get home, I'll be like, did I do this? Did I do this? And I just think it's a lot to deal with the understaffing. A lot of patients and the public don't see that, how hard the understaffing really is and how much of a strain it can not just put on you but everyone around you and your entire team, so it makes a big impact on you.
Can you share a memorable experience that has deeply impacted you?
Good or bad?
One good, one bad.
One good and one bad. Okay. So one of the worst things I think I've seen is when we have a lot of mental health patients at the same time. They're obviously in a lot of distress. They've come in for a reason, whether that's low mood or issues at home, and that's really, really difficult for them to deal with, and I feel terrible for them, and I try to treat them in the best way that I can with empathy and understanding that they deserve. But unfortunately, because they are in such a high stress situation themselves, they're on a busy ward with screaming children, I know that can be really, really overwhelming for a lot of them. So unfortunately, I have experienced violence, I think, is a big one. I've experienced a teenager throw a printer across the room, throw chairs at me and my colleagues, and even injure some of my colleagues at the time. And it's really difficult to deal with because you can't actually restrain them. You have to call security to come and help you, and it's really, really scary. And that's one of the worst things that I've seen and experienced and been in, because you feel so out of control in that situation and you don't know how. I don't feel like I know how to help that patient, so yeah. One of the good things that I've seen is the staff pulling together and doing everything together and working together. It's amazing what the NHS and staff in the NHS can achieve together. I've seen people pull together through the busiest days and support each other, look after each other, help out each other. And when the staff and the team come together and treat all of those patients with the best care I've ever seen, it's amazing, and it's the best thing I've ever seen.
Do you think you need like a little nursing community when you're like doing your nursing little jobs? Like, do you think you need that?
Do I need a community around me? Yes, 100%. I don't think I would have coped at all without people around me and a nursing community. And I wish that maybe there were more support systems out there to support newly qualified nurses, or nurses who've been nurses for years and years, or newly qualified, because I don't think there's enough support out there, enough help, especially when you just start, because it can be so overwhelming. And I really do think having those people to talk to and share your own experiences with can make a huge difference in who you are as a nurse, how you nurse, and how you actually better your own practice and become an even better nurse.
How do you manage the emotional and physical demands of nursing?
The ways that I try to look after myself is by debriefing with my own colleagues, talking about the day, making me feel better, coming home, trying not to think about work too much and looking after myself, so having something like a bath, reading my books, playing the Switch. I love playing the Switch. Like, that's one of my favourite things to like unwind. Like, they're good little things to look after yourself. Doing something that you actually enjoy, because actually that makes me a better nurse. So the next day when I go in to work, I feel refreshed, I feel ready to look after all my patients. Because I've looked after myself, I can look after everyone else better.
You play on the Switch. What do you think your favourite game is to play?
I've just played It Takes Two on the Switch with my partner, and it is the best game I've ever played. It is so fun. I'm also playing Lego Star Wars at the moment as well, and I absolutely love it.
Which parts of your nursing career have you found the most enjoyable?
Oh, this is a nice question, because I have actually found a lot of, as negative as how I've been talking, I have found an awful lot of it enjoyable. I find learning every day really enjoyable, because I love learning about new medicines, new guidelines. It's so fascinating. I love it when you've had a child who's been sick in any kind of way, or they've had an injury, broken their arm, you've helped treat their pain, you've either helped cast up their arm, they've come in with bronchiolitis, you've fed them for a few days in medicine, and you get to send them home. Seeing how happy that makes the parents, sending them home healthy and well, seeing that child go home much better, and just how well they look, and knowing you've had a part in their journey there, fills me with joy. And it makes me so happy knowing that I get to be a small part of their journey in life, and it just makes me so happy. Like, I'm literally smiling about it now. It's those moments that make everything absolutely worth it, and it's honestly incredible, and I wouldn't change it for the world.
Could you also name me a few things that you're proud of achieving?
I'm so proud of achieving my actual degree, hence I'm newly qualified. Like, that is one of the proudest moments of my life. As soon as I qualified as a nurse, I literally burst into tears outside the hospital, was like blubbering, was like, oh my God, I've done it. Like, I can't believe that I've done it. It was the proudest moment of my life. And I think another proud moment of my life is realising I can do this. Like, the other day I had quite a tough shift. It was understaffed. I had quite a lot of high intensity patients, and I got through the whole day with my team, with the other newly qualified nurses, and I pulled through. All my patients got exactly what they needed. I remained caring, I remained kind to them, my communication remained, I'd say, as a good quality. And at the end of the day, I was like, you know what, I'm really proud of myself. My patients all got what they needed, they got what they needed from me, and it all ended well. And I was really, really proud of myself, because that was a very tough day.
Now, we are moving on to the future of nursing. The nursing profession has changed dramatically over the years, and it will continue to evolve. For example, technology, including artificial intelligence, is starting to play a bigger role in healthcare. Imagine a world with robot nurses assisting in routine tasks. A 2023 report by McKinsey highlighted that advancements in AI could enhance diagnostic accuracy, streamline administrative tasks, and free up more time for direct patient care. However, it's also emphasized that human nurses will always be essential for providing empathy and judgment. So, how has the nursing profession changed over the years?
I think it's even changed in the time that I started being a student to now. I think part of nursing, one of the biggest things has changed is the state of the NHS. I mean, for example, on my last assignment that I did for university, I got to look at how nursing in the NHS has changed over the years. And the amount of nurses and doctors who have left the NHS since 2010 specifically is huge. The staffing is such a huge issue, and I think staffing is such a big issue in nursing today. And I feel like the scope of nursing has gone up. So what's expected of me and other nurses is I think getting a bit too much. Not only are we looking after children, I'm also do ITs. I solve problems that are outside of my scope of practice and don't give me a lot of time to give to my patients because there just aren't people to do that. And I feel like they need to bring in new professions, they need to have better training days. But nursing is always changing and always moving forward and always a learning profession. So I do think I'm going to be in a career that is forever changing, but does need some permanent changes.
What do you think will change in the future of nursing?
I hope the new generation of nurses coming through, me being one of them, and I think a lot of us realise that it's difficult, it's emotionally difficult, and I feel like a lot of us are trying to look after ourselves a lot better. And I think in the future there's going to be a huge thing come about, a pay rise in nursing potentially, different hours working in nursing, because 12.5 hours are very, very long days. And I think our culture is about to looking after yourself a lot better in nursing due to the new generation that's coming through, and I think that's about to have a huge change within the NHS.
What impact do you think on technology wise will have on nursing? Like it could be AI or robot nurses.
I see. So I think it can be useful in some ways, but also horrendous in others. I don't think AI could ever fully take over the role of a nurse. I think maybe it could help us with some things like medicine calculations and things like that, so I don't have to do them all. So I think that would be great. I'd love it if that would come in. That would help me a lot with my day. However, I don't think they'll ever be able to replace nurses in terms of that real human interaction, that real communication, that empathy that you need, that caring that you need, and actually being able to notice specific changes in patients. But I think sometimes they waste their money in the wrong area on AI. I've seen penguins go around hospitals carrying medicine to different wards, which costs lots and lots of money, millions of pounds, when the ceilings are falling in. And I think they need to consider where AI is going to be useful and where it isn't going to be useful.
Lastly, we are moving on to some extra questions just to wrap things up. What is your next step for you that you want to do?
So in my nursing career, I'm going to try and stay in my general ward for a little bit longer, because I'm learning loads and loads and loads there, and that means the longer I stay, the more experience I get, and that means I can go into something that I want. For example, I am actually really interested in asthma nursing. I find that very fascinating, so I'd love to maybe go into a band 6 role as a clinical nurse specialist into asthma, because I find that so fascinating. Or I'd like to do something like in GP practices and maybe move into a more Monday to Friday 9 to 5 clinical job, as I really enjoy public health. That's like one of the things that I'd really love to go into in the future, and things like vaccinations. I really enjoy those kind of areas, but I'm still working it out. Who knows, I might like something else in the future, but I think that's what I would like to do moving forwards.
What other career would you be interested in if you were not a nurse?
I actually got asked this recently, and I really, really struggled to think of another career, which I'll take as a good thing. But honestly, for now, I actually think I love nursing so much that I can't imagine myself being in a different job. I really can't. I really thought about this when someone asked me, and I was like, I don't know. I just love nursing so much. Yeah, I don't think I could pick anything else.
What advice would you give to someone considering being a nurse?
Embrace it all. Embrace every part of it. Embrace the sad parts, embrace the parts where it's difficult, and definitely try and embrace all the good parts and really hold on to the good things, because it makes it all worth it in the end. Just keep going. You've got this. Talk to people. If you need help, definitely tell someone. Do not keep it all to yourself, because I've done that and it didn't end well. Like, your mental health will get worse. Keep going. Embrace everything that comes at you and take it all as a learning experience.
And finally, are there any nursing secrets out there that you want the world to know?
Right, I recently got given for Christmas an ampule opener. So that's like, so some medicines you get in like little glass containers basically that you open, but you have to open them just wearing gloves with your bare hands, and you can literally get the glass to cut you by accident. So to avoid that, got a little glass ampule opener for Christmas. Basically, it's a cute little nurse that you pop over the glass and you snap it, and nobody gets any injuries. So that's so good.
That brings us to the end of today's episode of Navigating Nursing. A huge thank you to Millie for sharing her journey and insights with us.
You're welcome. Thank you for having me.
And thank you to all of our listeners for tuning in. If you enjoyed this episode, don't forget to subscribe, share, and give us your opinions. Join us next time as we continue to explore the incredible world of nursing. Until then, take care and keep navigating. This episode of Navigating Nursing was written, edited, and produced by me, Tristan. Music by Infraction, London Vibe, Fresh Beat, found at inaudio.org, and Albert Bahar, Puzzle Pieces, found at upbeat.io. Thank you for listening.